Okay, hi, it's Dr. Buford. We're just getting started on the right shoulder and from the back to the front. Everything that you see is magnified 30 or 40 times on the screen. We've got a blue cannula coming in the front of the shoulder there. Just to the right of that cannula is the subscap tendon, which is the anterior part of the rotator cuff, kind of running up towards 11 o'clock on the screen. And then that's just one of the normal variants. As we look down the front of the shoulder, we can see you've similar story on the glenoid, but really the one area that looked to have the most cartilage loss is this little area that we just saw on the humeral. Hopefully shouldn't be a problem. We can see some of the old suture material from prior surgery. We're going to go ahead and put our shaver in and get to work cleaning up this tear. But in the meantime, we'll get our spectrum hooks open and our super shuttles ready to go. So it looks like this was an old triple loaded anchor. And with our shaver here, we can clean up this footprint pretty quickly, as you see us doing. Okay, so we'll keep working here, show you some more in a little bit. I just wanted to show you that we're going to have a little bit of work up front here just to get out all this old suture material. Okay, I just wanted to show you what we've been doing. For up above the rotator cuff tear now in a part of the shoulder called the subacromial space, we've been doing a bit of a revision decompression, taking off a little bit more of the anterior acromion and up in this region. So you can see how this is now a lot flatter. Before, this was actually still trapping that blue cannula. And now we've opened that up, so that shouldn't push on the cannula and it shouldn't push on the rotator cuff anymore. That's your clavicle. You had a little bit of a spur hanging underneath it here. And so we've worked to make sure that that also won't push on the rotator cuff going forward. Okay, now, there's the tear. We're going to look at that in just a minute. Hold the camera. Okay, so here's the tear. And hold the camera there for a minute. We're going to go ahead and start with what we call margin convergence sutures or side-to-side sutures, kind of the same thing. And so the sutures are going to go across. Here's the tear. The sutures are going to basically go across just like that. We're going to put one at the apex, a second one here, maybe even a third one here, and then we're going to place one or two anchors in. Okay, so grasper in the blue to him and crescent. Yeah, put that right there. Okay, and so the suture hook will be coming in just a minute. Here's the hook. So you can see here how the hook is going to come across the tear. Let me give you the scope. Two hands on the scope. I'll take that. Great. So we're going to, again, I don't want to be way out here. I want the first pass to do a couple things for us. I want it to be full thickness. So now I'm sure that I'm all the way through, and I want it to be back here. So there we go there. I'm going to do this in 2 bites just to be sure I get this exactly where I want it. Pause. Okay, so now we're going to reach in and get this limb, bring this out the back. We've got them tagged so we know which strand is which. And now we're going to do the second half of this stitch. Hold the camera. Stay right there. And now, just like before, we want to make sure we're getting through all the layers of the cuff here. We're going to lift up, make sure we're getting all the way through. We want to get back medial and a little bit over there like that. There we are, coming through just about. And now we'll feed that relay through. This is why I like to use a relay system here, so I can place these sutures exactly where I want. Okay, pause. Okay, so now you can see our stitch is going across. We're going to reach in and get this anterior limb that's coming out right there. And now we have a good, what we call a ripstop stitch, just medial to that tear. And I'm going to go ahead and tie that just like that. Pause. Okay, we're going to do another stitch here. Rotate about. Yeah, okay. And so we're just checking our angles. Again, I want to make sure I'm getting through the full thickness here. Now that we've already placed the first stitch, I think these can go in one bite. Pause. Okay, so this is where we're at just with placing 3 side-to-side sutures, and I'm happy with that. We've got this repaired all the way down to the lateral aspect, or the medial aspect of the footprint rather, which you'll see in just a minute here. So you can see there's the articular margin there. So this is the old medial row anchor right there. And so we're going to place our first new anchor back here. We want to get way back here, make sure we cover this. So that's going to go right about here, I think. May even move my... Yeah, I think I like that even better. So we're going to place one anchor in way back here. We'll get to work on that, show you some more in a little bit. Okay, so here's our first triple loaded anchor coming in the back. We're going to go ahead and take some out the front next. Okay, so we're getting ready to place a second triple loaded anchor, and we're going to basically split the difference. I'm going to place it right about here. The first stitch is going to go through the posterior aspect there, and the second 2 sutures are going to go through the anterior leaf because we're right up at the interval almost. Okay, hold the camera. Okay, so here we are with everything repaired. We've got 3 side-to-sides and 2 triple loaded anchors, and way back in the day we'd be done, but this wouldn't heal with a very high percentage. At least not as high as we would like. And so now we're going to augment this with a graft. It's actually an implant called a Biobrace. And we're going to place this just right over the top. And we'll show you how we do that in just a minute. Okay, so now we're okay, pause. Okay, so you can start to see how the graft is going to sit here. I'm happy with that. Okay, and so now the next step is to go ahead and start to tie some of these sutures. So we're going to grab this stick knot right here next. Okay, so here you can see we've got the medial sutures passed. We haven't fixed it laterally yet. We're going to get ready to do that right now. We're going to take out these sutures first. These are the posterolateral. And then what that leaves us with are these white anterolateral sutures, and we're going to decide where to put those. Probably someplace down about here. Let me rotate the camera so you can see better. Yeah, someplace down about here looks pretty good. Like that. Pause. Okay, so there's the first luggage tag stitch down right there. Happy with that. We've got to get this blue one down next. And I'm not sure, I think I may want to put the suture down right from where my camera is. So we'll show you some more in a minute. Okay, so we're done. There's our medial sutures. There's our lateral. Sorry. There's our lateral. And as we move this all together and rotate the shoulder, that looks real good. So I'm very happy with the way that looks. We're going to finish up here and get you back to the recovery room shortly. So good luck to you now. Bye-bye.